Welcome back to Passionate World Talk Radio. Educate, enlighten, entertain. And this morning, my special guest on Cool Year Hills is Dr. Joanne Pike, who's with the Alzheimer's Association. Good morning, Joanne. How are you?
Good morning, and thank you for having me.
Well, you're very much welcome, and I also believe that it's very important to understand the shortage of primary doctors that will be available to take care of Alzheimer and dementia patients.
Yeah, it's been a focus of our special report this year, so it's great to have an opportunity to talk about it.
Well, I know that my listening audience would be very, very interested. We've been running a series on caregiving for Alzheimer's and dementia and Parkinson's spouses now for a year, and the response has been overwhelming. So I well believe that same audience would want to know whether or not they're going to receive the proper care when their spouse or other loved one is diagnosed with Alzheimer's or dementia, and what will happen if they can't find the available medical professional to help them keep their spouse or loved one in good health.
Mm-hmm. So I think, one of the things that certainly we explored within the special report was how many specialists are available nationwide, but also how can we enhance how primary care physicians, who really know a patient and their family the best, can receive additional training and support. Would it make sense, though, for your listeners to hear a little bit about a top line of the report overall?
I think they would be interested in anything you can share with them, because I recently lost my husband to Alzheimer's, and I was lucky I had good medical help to help me through the ordeal. But there are a lot of people who really don't know anything about it at all.
Well, first off, I'm sorry to hear that you lost your husband.
Thank you.
And we agree completely with you that Alzheimer's and other dementia are challenging enough, and having access to quality health care shouldn't be another challenge that a family or an individual with dementia or their caregiver should have to consider or worry about.
So in your report, what do you say?
Well, let's start off with, we currently know there are 5.8 million Americans who are living with Alzheimer's today, and we anticipate that that's going to grow to over 14 million by 2050. One of the things that we looked at was a special survey with primary care physicians, and how do they feel about their knowledge, skill, and ability to provide support to those who are living with dementia. And one of the things that we found in that survey was that nearly 9 in 10 primary care physicians expect to see more people living with dementia over the next 5 years, but 50% of them say the medical profession is not fully prepared to meet this demand. One of the interesting things that we found in our survey is that 2 in 5 physicians say they're either never or only sometimes comfortable making a dementia-related diagnosis. And also, nearly a third of them report that they're never or only sometimes comfortable answering patients' questions. We think this really is sounding an alarm, that we need to take aggressive steps to bolster dementia care training and education in the country, because demand is only going to increase over time.
I agree with you. When my husband was first diagnosed by a so-called specialist in Alzheimer's, basically he told me to dump him in a nursing home and walk away. And recently I had just interviewed a neurologist who wrote a book about Alzheimer's and dementia. So I contacted her, and I took him into New York City to have him diagnosed and tested. And she said, I'm really glad you did. And so was I. So I was fortunate that I was in a position where I had just interviewed somebody who wrote a book about it. But I would say a good 90% of the population doesn't have that type of contact with anybody outside of maybe their own primary doctor.
Yeah, and that's one of the focuses within this special report, is really looking at what is the shortage that we're dealing with today and into the future for dementia care specialists. In particular, we focused in on geriatricians because geriatricians are specifically trained to care for older patients. What we found when we did this state-by-state analysis of how many geriatricians we need by 2050 to care for individuals that are projected to have Alzheimer's at that point is that nationwide we need to increase geriatricians by threefold. But there are some states that are in much more dire circumstances, with 14 of them needing to increase geriatricians fivefold to meet that future dementia care needs. So while, I think it's a great experience that you were able to find a dementia care specialist, all too often we hear stories of families that are left in a place where they don't receive enough resources or information. And we want to make sure that certainly individuals and their families have those resources in the community that they need. But we also want to make sure that primary care specialists or physicians feel a really strong duty to their patients. So we want to make sure they have the support they need as well.
And I think that's important. I know that there is a shortage of doctors within the states to start out with. So it's compounded by the fact that we don't have anybody who really wants to go into elder care. Is there any way that you can attract a variety of people who would want to specialize in elder care?
Well, I think there are some things that we have seen work in other specialty areas that we could possibly apply to this area. There has been some work done to entice physicians to work in rural America, for instance, like loan forgiveness programs. Is that an opportunity to look at, can we apply that within dementia care specialties, geriatrics, or primary care additional education? Also, we have seen where there are federal investments within medical schools within a specific area. More attention has been paid to that. So again, there's another opportunity there. Can we apply that same idea to geriatrics and dementia care specialties? But the other thing is we want to make sure primary care has the tools, resources, and continuing education available to them. So how can we also enhance our primary care education as well? One of the things that we're really excited about at the Alzheimer's Association is the work that we're doing with Project ECHO. And Project ECHO stands for Extension of Community Healthcare Outcomes. And it was a model built out of the University of New Mexico around hepatitis C. But what they identified was a need to give generalists, our primary care doctors within New Mexico, specialist-level treatment information. And they were able to do this remotely through telementoring, the use of telehealth-type technologies. And we believe that you can apply that same theory to dementia care. We've launched a Project ECHO series for primary care physicians nationwide, where we're really trying to bring specialist-level knowledge to primary care physicians who want to enhance their education around that.
That sounds like going to be a good program, and to get it out there and perhaps even get some of the kids who are considering going to medical school an opportunity to work within some of the facilities with established older doctors who work with the elderly. That would also encourage them to look at it as not being looking at it so they don't have to support their older parents as they get older. That seems to be the cry now from the sandwich generation, that they have to take care of their parents, and should one of their parents be diagnosed with dementia or Alzheimer's, it requires a lot of funds.
Right. There is a significant financial burden as part of this disease that we even talk about a little bit in facts and figures in terms of the cost of care to not just families, but also the country overall with Medicare and Medicaid. One of the other things I would mention in terms of successful models of dementia care that we've seen around the country, we have been able to show through research and quality care outcomes over time that places like UCLA, who have a collaborative coordinated care model, University of California, San Francisco, and Indiana University, where they are engaging allied health professionals along with a specialist or a primary care physician, that they're able to increase quality of life for caregivers and for the individual living with dementia, while also doing things that will reduce costs. So, for instance, through these collaborative care models, we're able to show fewer days in the hospital, fewer times that people are riding in an ambulance. And that's really the best case scenario, where we can improve how individuals receive health care, but also show lower cost or lower use of emergency care.
What about the caregivers? Is there any way that maybe some of them can learn some extra ways of caring for their spouses or loved ones, so that when they go to the doctor to get it confirmed that they're in the office a lot shorter amount of time?
Yeah, that's a great question, and we do believe that caregiver skill building and the resources that are available to caregivers is an incredibly important aspect of Alzheimer's, and in some ways unique. Alzheimer's, as you've experienced, is very complex, and it changes on a day-to-day basis. And making sure that caregivers have the opportunity to receive skill building, education, and also the support groups that they need to be a more confident caregiver is important as well.
Because I know that my doctor finally said to me, he says, if he's bad enough, just take him to the emergency room. But isn't that just taking his responsibility and giving it to the people over in the hospital to take care of?
Well, it's hard to say. Every situation is difficult, and whether a primary care physician is the best place. But if it's an emergency, we obviously want people to use the emergency services that they have available. However, if there's resources that caregivers can access in order to learn about, behavior changes or mood changes that could be disrupted in the home, we certainly want to make sure caregivers have those skills as well.
Oh, I agree. And people should be aware that once a person does have Alzheimer's, their personalities change a lot. Mm-hmm. And you should be on guard about it. Mm-hmm. Because I know one of the things my doctor always told me was, well, we don't like putting them in the hospital because they get confused. They don't know where they are, and they certainly can't always tell you what's wrong with them.
Right. And, I think everybody's experience for being able to provide care and having an individualized experience is going to be different. One of the things that I want to make sure all of your listeners know is that we do have caregiver resources. That's inclusive of, online support groups. We have community-based support groups and education opportunities around the country, and they can access information about that through alz.org. And also we have a 24-hour-a-day, 7-day-a-week helpline for anybody who has a question at the moment, who could be dealing with questions about those behaviors, or even just needs general information, and that's available at 1-800-272-3900.
Excellent. Is there anything else you would like to add that you feel like my audience would need to know?
I think the most important thing really to think about, especially when you consider caregiving and what we are seeing in our special report related to primary care, is that we want to make sure that physicians and caregivers and individuals who are living with dementia have the resources available to them that they need. And that means that all of that information can be accessed, whether you're a physician or whether you're a caregiver, at alz.org.
Absolutely. When I went into this, I didn't know any of this stuff. And you need to know it before something happens. It's very important.
Absolutely. Thank you for the time that you've given me today. I really appreciate it.
anytime. And you can listen to this interview all over again with Dr. Joanne Pike over at https:// World Talk Radio. Right-hand side, the menu, scroll down, Cool Your Heels, click on it. For those who are technologically not adept, we have a sizzle line. Just punch in the phone number and you'll hear the interview all over. No problem. And it's also posted on iHeart, iTunes, Spotify, Spreaker, Alexa, and all social media. And before you go away and stray, Bertrand Russell had this to say in 1926, no one gossips about other people's secret Virgils. Thank you very much for listening, and remember, please keep listening. Thank you. Hello?